I don't know what's going to be happening, what kind of bodily fluids are going to be floating around. That sounds so gross. But what's up, guys? Welcome back. My name is Lorrien, and for today's video, I wanted to share with you all my breast reduction surgery essentials. Now, I am filming this video before I have my surgery, so today is Wednesday, and I am having surgery this Friday, the 14th. So I'm filming this before because I don't know how things are going to be after surgery, how long it's going to take me to heal, recover, and then put makeup on and film a video and edit it. So I was like, you know what? Let me film this now. And if anything changes, if I do anything differently as I'm recovering and after surgery, then I'll just eventually film an updated video. But for now, I just wanted to share with you all what my doctor's been telling me I need, and just based on research. I've been wanting a breast reduction since, I kid you not, the 4th grade when I developed, and everyone bullied me about it. I know what I need, I know what I'm going to need and want, etc. And like I said, things change, I'll let you know. But let's jump right into it because I have the longest list ever. I just wrote everything down because I didn't want to forget, and as you can see, it's a long list and I want to get through it. So it's not in any particular order other than I put the items that I physically have first, and then the items that I don't have or items that I recommend I put at the end, just because I'll just put a picture on the screen. So let's jump right into it. First thing first, a giant water bottle. This one is not insulated. I do have an insulated one, but the lid is not like a screw-on one. It's just one that you kind of like put on. So I'm worried that when I'm like laying there like on a, recline and I go to drink, it's gonna tip over on me. Whereas this one, I know the cap won't come off. It sucks that it won't be cold because I feel like I'm really gonna want cold water as I'm laying there. It is what it is. But this one is a giant one. It is 85 ounces. I used this during my pregnancy with Amelia and postpartum, and it was great. Fill it and you have it all day. Next is an additional fan. Now, yes, we have air conditioning in the house, and yes, we have a ceiling fan, but I'm having surgery in the middle of summer in Michigan, and it's been like high 80s, close to 90 degrees every day. I don't want a chance of sweating and getting hot and risking like an infection or bacteria or anything where my incisions are. I want to be as cold as possible. So this little fan, I'm just going to keep like on my nightstand near me and just have it blowing on me so we don't risk, sweating, because if you know, boob sweat, not fun. And then after a breast reduction surgery, definitely no. Next is a pregnancy pillow. Now, it doesn't necessarily have to be a pregnancy pillow. Any type of like pillow where you can lean on. This I just had and I felt like it would be perfect because it is like that C shape. Where is that little picture? There's a little picture. Yeah, it looks like that. It's like a little, where is it? Right there. It looks like a C shape, and I used this during both pregnancies. Now, it did sometimes make me hot, but I'm not going to be using it like how I did when I was pregnant, where you put it under your belly on the side and in between your thighs. I'm just going to use this for behind me to prop me up because yeah, I have pillows, but I don't feel like my pillows are going to be enough, where this is more firm and I can just put it behind me because I'm not going to be able to sleep on my side for a while. I don't know how many weeks. Like, I'm not going to be able to sleep on my side. I have to sleep on my back and kind of like, sitting up. Plus, I don't know if I mentioned this, I probably did, but I'm also having lipo on the sides because my surgeon recommended it. He said that he can't get me to as small as I want to be. So he recommended that we can also do lipo on the sides here to bring them in some more. So I'm not going to be able to lift my arms, which you're not able to lift your arms regardless when you have a breast reduction. And the fact that I'm going to be having lipo right here, I just know I'm going to be extra sore. So this pillow, I feel like it's going to be perfect. That's why I said pregnancy pillow, because I'm just going to have it behind me and just kind of have my arms like, kind of leveled like this. So next, some baby wipes. Now, I've heard people say you can't shower for 2 weeks. My post-op instructions were I can't shower for, I think, 48 to 72 hours. So I'm probably not going to shower for maybe 3 days just to be on the safe side. But again, I'm going to play it by ear, see how I'm feeling after 2 days. But in the meantime, I'm going to have these wipes because I am going to have drainage tubes. So I don't know what's going to be happening, what kind of bodily fluids are going to be floating around. That sounds so gross. But thank God I have toddlers, because we always keep baby wipes in the house because I'm always wiping their little hands after they eat and their mouths. So I'm going to borrow one of their packs and I'm going to use this until I can take a shower. Gauze. Mainly these hurt-free ones. This is very, very important because, like I said, I don't know what kind of bodily fluids, leakage I'm going to be having, and you want gauze. Even though I know I'm going to be padded up, but just in case you need extra, make sure they are the hurt-free ones, because after I had Amelia, I had an abscess under my left breast and it was really, really bad. I had to go to the ER, have it surgically cut open, drained, and they just put regular hospital gauze, and when I went to remove it, it was starting to heal within that incision, and ripping that off was seriously the worst pain. Even though, you know, it was doing it slow, it was the worst pain ever. So I went on Target's website and I found these ones and I was like, what? So I bought them, tried them, and yes, they're definitely hurt free. They don't stick to your skin. They're not going to stick to your wound or your scar or whatever. So make sure they're hurt free. Then you're going to want some lip mask. My lips are always dry and chapped no matter how much water I drink, how, you know, hydrated I am. My lips are always chapped. So I love the Laneige. This works the best for me. I've tried other ones and I like this the most. So while I'm laying in bed with chapped lips, I'm going to be using my Laneige lip sleeping mask, and specifically this one. I think this is like berry or whatever. It's like their original. I like this one the best. Some soft silk scrunchies. Now, for those that don't know, I have scarring alopecia and I recently chopped my hair off. Actually, it's really short. I have it just in a bun, but I cut it to about here, like sits right on my shoulders. So I don't have much hair to worry about, but I know for my thick hair, long hair girlies, you're gonna want some scrunchies. These are silk. I got these off of Amazon. They are linked on my Amazon storefront, but they come in like this really nice box. As you can see, I've already used, I think it was like 6 in here, and I love them so much, so I need to actually buy some more. For those that don't have alopecia, I would recommend like dry shampoo and keeping your hair like maybe in a braid and using like these soft silky scrunchies until you can wash your hair, because you're not going to be able to wash your hair for quite some time. So I'm just going to wash my hair and blow dry it the morning of surgery. I'm just going to keep it in one of these. Next, you're going to want some kind of tray for your bed, or if you're on a couch, then you probably can like pull up like a little table next to you, but I'm gonna be laying in bed. So if you have like one of those breakfast and bed type of trays, that would probably work, but I personally didn't want that because like it's, you know, those kind of lay over your lap, and then when you're done, you're gonna have to pick it up and move it, which I'm not gonna be able to physically do. So I already had this and I figured this would be even better because I can put this next to me and put like, you know, my bowl of soup, my water, whatever, like snacks, whatever I need, my tissue, stuff like that, I can put all on here and I can just have it next to me. I feel like it's going to be easier to just grab and put back versus if that tray was like over my lap, then I have to pick it and move it if I, you know, don't want it there anymore. Then speaking of tissues, I have terrible allergies and I'm constantly, like my nose is constantly running. So a box of tissues next to the bedside on your nightstand, plus like I said, any bodily fluids that, you know, you're gonna want some tissue right next to you, handy in reaching distance. Then this soap that the doctor tells you to buy, I can never pronounce it. Hebiclins. I don't know, but this is what, you know, they gave me in my post-op instructions. It's open because I already have it in the shower. I've already started using it. I'm supposed to use it, I think 2 to 3 days before surgery, so I started using it yesterday. So it's in my shower currently, but this is an antibacterial or antiseptic skin cleanser. It's I think like an antimicrobial skin cleanser, blah blah blah. Basically you want to use this before surgery. Then post-op, you're not going to be using this anymore. Post-op, they recommend just like some fragrance-free soap, Dove sensitive, I have as well, or Dial. I've used Dial in the past when I had surgery and it worked for me, so I'm just going to use Dial right now. I have a bar of soap. I'll probably get like some liquid body wash afterwards, but for now I have this, so I'm going to be using this post-op when I do eventually shower. Now let's get into a little haul. So first, don't come for me. I did shop off of Shein's website because I just needed some cheapy stuff real quick. So yes, I did order off Shein. Again, please do not come for me. But They recommend you wear a button-down zipper type of hoodie. Now, because I'm having surgery in mid-July, the like hottest of the hot time, I needed some like zipper hoodies. I didn't want button up because my husband sucks with stuff like that. Like, I remember when we were first dating, I asked him to zip up a dress and he struggled. I had to drive to a friend's house and she had to zip me up. So I was like, I'm not getting buttons because he's never going to be able to like unbutton on a person. He can do his own buttons, but he can't do it on someone else. So anyways, and all my like zip up hoodies are winter thicker material. So I'm actually opening these for the first time. I haven't even looked at them because I wanted to open them with you, but I bought these like really light thin zip up hoodies from Shein. They're lightweight, so I won't be hot, and they're kind of like airy and flowy. So I'll be wearing this like when I go to my surgery appointment, because like I said, you have to wear this. And then I got a white one. It's not the same kind, but it's like zip up, but this one is a little different. This one I figured I can wear after until I'm done healing. I don't want to wear the white one to surgery because I know there's going to be blood involved, so I'm going to be wearing the black one. Once I'm healed, drainages are out, then I'll switch to the white one. And I did get this, let me see, the black one I think I got in a large. Let me check. Yeah, the black I got in a large, and then the white, I think maybe did I get extra large? I can't remember. No, large, same thing. So the white one I also got in a large. The white one does look like it runs big, but it should be okay. Next, some button down PJs. Again, I have to, you know, wear buttons for a while. So what is happening? Of course. Now how did that happen? There we go. Okay, so I got these silky, they look like really sexy, but I got these silk short PJ set. This looks like it might be kind of big. I'm a little nervous, but oh well. And then like I said, just short sleeve button. Can you see that? Yeah, there we go. And then I bought another PJ set. This one was so cute. I'm nervous though because it is white that, you know, may get blood on it or something. Hopefully not. But same thing like the other one. Button, short sleeve. It has little hearts on it. It's really cute. I think the black was also in a large. Yeah, a little L right there. It's a large. And then I think I also got this in a large because I wanted it loose. I didn't want it being tight fitting with the bandages and the drainage tube and the gauze and the bra and all that. So I went bigger on purpose. So I think I showed that. I don't know if I did here. Large. And then the shorts are kind of similar like the other ones. I am about to throw these in the wash as soon as I'm done filming because very important. Wash everything, especially from Shein, before you wear it. Okay, now we're getting into the items that I don't physically have, but I recommend. So long phone chargers. I have an iPhone. I ordered them from Amazon. I'll put them on the screen. They should be arriving today, I believe, or tomorrow. I think today. But they're 10-foot chargers. It came in a 2-pack. So one, I figured the extra one, whatever, you can always have as backup. Then Tylenol Extra Strength. They've recommended Tylenol, no NSAIDs like Aleve, ibuprofen, stuff like that. So Tylenol I can take before up until surgery, and Tylenol is recommended for post-op for pain control. I don't know if they're gonna give me painkillers. Usually, like, I've had surgery in the past and they gave you your prescription, your painkillers before, so that you fill it and you have it at home ready for you when you get home, but they did it this time, so I don't know. But if they do give me painkillers and if I do need them and take them, stool softeners. Make sure you have stool softeners because pain medicines will, if you know, you know. You're just gonna want stool softeners, extra strength. Zip up bras for after. So I'm not gonna be able to wear anything with an underwire for I think 6 months after, so you don't get like indents or whatever. But zip up bras after. I haven't purchased any yet because I want to see what my actual size is going to end up being, and once I figure out what size I am, then I'm gonna order some zip up bras. So kind of zip up in the front is what I mean, because I feel like it's gonna be too painful to try to like reach back. And so zip up bras in the front once I figure out my size. Ice packs. Now I didn't buy any because I'm just gonna do like ice in a Ziploc bag. Place a towel over my chest first and then put the ice over. You don't want to put it directly on your skin because if it touches your nipple, then it could like damage your nipple. So ice packs, if you want to buy them, I would recommend some off Amazon. But like I said, I didn't feel like wasting the money, to be quite honest, when I know I can just put like some ice in a Ziploc baggie and place it like in a towel. So same thing. A pillow for the car ride. So Amazon has like these pillows that go over the seat belt, but I don't feel like I need to do that. I'm just gonna take a pillow with me and just place it in between like the seat belt and my chest, so the seat belt when we're driving doesn't press up against my chest. We do have a bit of a drive. I think the place is about 30-35 minutes away from the house, and I don't know if there's gonna be traffic, so pillow to protect the new boobies. And then just some stuff to have to make me comfortable, like fresh sheets. I washed the sheets the other day, but I think I'm gonna wash them again Thursday right before surgery, because I love my fresh sheets. It makes the world of a difference, and I love to spray everything down with Febreze, so it just makes me happy. Then soup and vegetables and nutrition and all the good nutrients. So I'm going to make a giant pot of chicken noodle soup, like homemade chicken noodle soup, Thursday before surgery. I'm gonna, I'll include that in the other vlog. Chicken noodle soup to have for like when I get home, because you're gonna want nutrients so that you heal faster, quicker, better, avoid spicy food, fried food. So that's why I plan on making a giant bowl of soup, or a giant pot of soup, and then just some snacks like crackers and stuff to have next to me. And then TV and book, I'm gonna be switching back and forth. I bought this book when we went to Cali and I read it on the plane, but I didn't get a chance to finish it, so I'll most likely be finishing it then. And I think that's kind of it. I'm super nervous and super excited. You guys will be seeing this video after I've already had my surgery. Right now I'm so excited. I'm starting to get a little nervous as like we're approaching, but I'm just so excited. Like I can't wait to not have back pain, neck pain, shoulder pain. I'm excited to have a bra that fits and not constantly, like I'm constantly doing this. Like even in my videos, I'm constantly like adjusting. It's just very uncomfortable, and the pain as well. Like every day I wake up with back pain, and it takes me hours until the back pain kind of like either I get like adjusted to it or it goes away. It doesn't really go away. I just kind of get adjusted to it, but that is it. I don't want to make this video super long. I just wanted to film this because it's helped me. Like I've been researching and stuff and watching other girls and their videos and what all they use, and I was like, you know what? Yeah, that's a good one. That makes sense. So I just wanted to film this for anyone else out there considering a breast reduction. If you're not for surgery, cosmetic surgery, then it's kind of late now. You shouldn't have watched this video. But this is not, I wouldn't consider this cosmetic. I would consider this more as a necessity. But I'm rambling now, so thanks so much for watching, guys. Don't forget to subscribe on your way out if you haven't already done so. I will see you all after surgery. Bye, guys.